Did you know a single wrong stitch can delay healing, cause infection, or leave a permanent scar? Surgical stitching is not just sewing skin, it's a precise medical skill that saves lives. Today, let's understand how surgical stitches are actually done. Wound preparation. First, the wound is cleaned thoroughly. Doctors remove dirt, dead tissue, and bacteria. This step is critical because stitching a dirty wound can trap infection inside the body. Then the area is sterilized and numbed with local anesthesia, so the patient feels little to no pain. Not all stitches are the same. Doctors choose between absorbable sutures, which dissolve inside the body, non-absorbable sutures, which must be removed later. Using the wrong suture can cause poor healing or wound reopening. Stitching technique. Now comes the most important part. Using a sterile needle and thread, the doctor gently brings the wound edges together. Not too tight, not too loose. Too tight, blood flow stops. Too loose, the wound won't close properly. This balance is what separates skill from mistake. After stitching, the wound is checked again for bleeding. Then it's covered with a sterile dressing to protect it from germs. Patients are advised on wound care because poor aftercare can ruin even a perfect stitch. Subscribe and like Medical Officer Pro for more real medical knowledge explained simply.